Ethical issues in maternal immunisation. Now, I'm sure there are a small number of you who are wondering why on earth are we bothering to do this? It may be because talking about ethics at 8 o'clock at night is a little bit like getting to a very pleasant meal with a group of friends on a Saturday night, and at 10 o'clock someone says, now I want to talk about the meaning of life, and the rest of you are all grown. So that may be what you're thinking, or you may be thinking, well, we've had an evening now of conversation about why immunisation during pregnancy is a good thing, and the last thing that we need is an ethicist who can neither treat anyone nor count, standing up here talking about why we might want to worry about this. So I hope I'm not going to convince you that we ought to be worried about this, but I do hope I'm going to give you an opportunity to think about some of the things that might underpin the approaches and the attitudes and the values that we bring to immunisation during pregnancy. One of the reasons we might want to talk about ethics in maternal immunisation is because if we understand better what the factors are that shape people's attitudes, be they clinicians, policy makers or patients, we will do a better job of getting appropriate uptake. We may also want to talk about immunisation during pregnancy and the ethical issues that attach to it, because ethics has got a lot to do with patient values and patient beliefs. And if we get those things right, we'll do a better job of supporting the integration of patient perspectives. But the really big reason why I think it's worth talking about is because everything that we talk about when we talk about new technologies, they may be drugs, they may be widgets that do clever things, they are certainly going to be immunisation, is beset with questions about what makes it safe, what makes it good, how do we balance those things against each other, what makes it worth our while as a society to put money into these things. So they're the kinds of reasons that I think about when I ask myself, why would I bother to do this? I also think, well, this is what I do for a living, so of course I want to do this. Anyhow, what I'm going to do is I'm going to take you through a bit of a whistle-stop tour of some of the kinds of ethical issues that might arise if you want to think about maternal immunisation. And I'm going to group them into 4 areas. I'm going to talk about issues that relate to infectious diseases during pregnancy and women and babies. I'm going to talk about some issues that relate to immunisation during pregnancy, to the technology of immunisation. Then I'm going to touch fairly briefly on issues that relate to people who provide services and people who deliver programs. And finally, very, very briefly, a couple of points about societal perspectives and ethical issues from a society's point of view. A lot of this people have already talked about this evening, so it's probably more a matter of collecting it up in a particular way. So first of all, a set of questions. What sorts of ethical issues might attach to infectious diseases during pregnancy and to questions about mothers, fetuses and babies? I like doing ethics of infectious diseases because infectious diseases raise some quite peculiar ethical challenges. They're the only area really of healthcare practice where the person who gets sick and is a victim is also possibly the person who can make someone else sick. So that means that when you're thinking about being immunised at any point in your life, you're not only thinking about what it might be like for you as a person, but there are also a set of questions about how what you may do may affect the health status of other people who may be unknown to you. And it's even more complicated for maternal immunisation because maternal decisions about immunisation not only can affect people around you whom you don't know, but they can affect a being who you may be caring a great deal about, a fetus, your potential baby, and that being is of unclear moral status. So there are a set of questions here that I think are really quite intriguing. So at least from a sort of rational point of view, if women are thinking about being immunised during pregnancy, they're going to need information. And I think Ross particularly has talked about the kinds of information and the need that women will have to have information about this thing that they're going to have done to themselves. So they will want to know some fairly standard stuff, I hope, about what they're trying to prevent and how serious that might be for them or for their baby. They may want, and I would hope would want to know about how likely it is that that thing's going to happen to them, and what are the risks that actually attach to immunisation for them and for their baby. And we can be, I think, on the basis of what I've heard this evening, fairly confident in the sorts of answers that we give people. And they're also then going to need to do some balancing, perhaps. They may have to think about weighing the benefits and the risks for them and for their baby. And they may also want to think about, well, what's the potential impact on the people around me, on family, and on society in general? At least for some immunisations, we do it because we're trying to protect other people. And they may not be us, they may be others. Now that divides up fairly easily, and what I think people who advise women about having immunisations during pregnancy are really good at is giving them the facts. Now those facts are getting clearer. They've not been as clear in the past in terms of what information gets provided, but they can be. But I think in general, it's not that hard to get the facts right. What is much, much harder is helping women to think about, how do I do this balancing act? How do I work out what's best for me? How do I work out what may be best for the people around me? Usually, women are going to be able to be in a situation where they'll be making decisions about their own best interests that will be similar to the ones that they would want for their children, but it won't always be like that. Now, all of that, of course, assumes that women who make decisions about immunisation during pregnancy are doing it as rational, isolated individuals just sitting there working out what the balance of goods over harms are. Now, it's not like that. Because the kinds of decisions that we make during pregnancy are ones that are strongly influenced by people around us. We may be influenced, and many of us are, by our families. So I think it was Ian and Ross who mentioned mothers and mothers-in-law. Those groups are likely to be important, and if you think immediately about the kinds of values and attitudes and practices that were in place at the time when people of my age and a little older were having our babies, they're different to what they are now. So those sets of beliefs and values will be at play. Then, in addition to what one may get from healthcare providers, there is a huge amount of information out there that women are subject to, that they actively go ahead and seek out, and that they know of. You don't have to do an awful lot of searching on the internet before you discover that it's pretty easy to get into information overload in pregnancy these days. There's an awful lot of telling people all the things that they have to do and telling them all the things that they do not and ought not to do, and you can go to 2 different websites and you'll get 2 different sets of things. I think it's also worth remembering that not all women are the same. So what makes for good information to help someone who is white, middle class, maybe a midwife, maybe a doctor, make a decision about immunisation during pregnancy is not necessarily going to be meaningful if you're 16 and pregnant and have no partner, or if you're of non-English speaking background. So information needs will vary, and the pressures and the values that shape people's decisions will vary depending on who they are and the context in which they're living. So it's a pretty complicated picture when it comes to women making decisions about whether to be immunised in pregnancy and what they ought to do and how to have it happen. The next thing I want to touch on fairly briefly is ethical issues that relate to the technology itself, to immunisation. And I want to mention 3 things. The first one is this notion of the minute you can do something, we have to do it. The second, something that I think Mike raised about drugs in pregnancy and the value that we as a society have about that. And the third one are some broader social issues or social values about immunisation that are prevalent in our society. So first point about this imperative of possibility, which is a phrase that one of my colleagues, Bjorn Hoffmann from Norway, has used, and he's drawing on a very strong tradition that suggests that the minute we can do something in healthcare, the minute we have the capacity to do it, we tend to always want to. Immunisation sometimes strikes me as a little like that. We have a progressively growing number of immunisations. Each of them is incrementally an addition on the previous one. And because it's only an incremental change, there really isn't a huge opportunity for people to stop and think, is this how we really want things to be? Because we are conditioned to thinking if we can do it, then we ought to. Second thought, which is about the way in which our society thinks about immunisation. We're not the only country in the world that has a strong anti-immunisation lobby. It's quite an interesting one because we don't have the same sort of lobby against Panadol. But we have a very strong view amongst a substantial minority of the population, and they're not stupid, they are generally very well educated, that immunisations per se are a bad thing. There are a whole set of other things that would be good, but immunisations are a bad thing, and that view plays over more generally into conversations about immunisation during pregnancy. If you're worried about immunisations for your children, you should be even more worried about doing it to yourself during pregnancy, because there is this very, very strong cultural history that says taking drugs during pregnancy is not a good thing to do. Mike raised that issue. I think it's probably combined with the notion that it's women of my generation who went through pregnancy not even taking Panadol at all because you never took any drugs. When you can think about us as mothers advising our daughters, then putting those things together, it is not at all surprising that many, many women are somewhat concerned or not, at least not sure about immunisation during pregnancy. So again here, some pretty complicated messages and values around the technology of immunisation during pregnancy. So the third area then relates to a set of ethical questions that might arise, or issues that might arise about the providers of immunisation services and program delivery. Now this ought to be straightforward. We know that what health professionals know and their attitudes towards immunisation are crucial for the uptake of immunisation during pregnancy. That's fairly straightforward. But health professionals' decision making and their own beliefs and values are complex. How they speak to women about immunisation can be as important as what is actually said. And the third point that I want to make is health professionals don't speak with one voice either. So first of all, I think it's based on, I guess, particularly what Ross has said, it shouldn't surprise any of us that clinicians are not necessarily themselves all that clear or all that explicit about immunisation advice to women during pregnancy. This little report comes from a study published earlier this year in BMC Family Practice. It was a qualitative study, see I can read words, I just can't do numbers, of general practitioners in New South Wales and their behaviours, attitudes and responses to women who were presenting with requests or wondering about immunisation during pregnancy. And the classic quote from them was, "We don't push it. We do not insist, we just advise them. If they accept, well, that's fine." So it really is about choice. And choice is incredibly important. So these GPs are framing decisions about immunisation during pregnancy, about helping women to make their own choices. They wouldn't probably frame their advice to women to make their own choices in the same way if they were talking about smoking during pregnancy. or 4 glasses of wine per day during pregnancy. So there's something slightly different going on here. That's the first point. That those something slightly different things relate, at least in part on the basis of this study, to these GPs' views about trust and the fact that more important than a woman accepting immunisation during this pregnancy is that she continues to trust you and will keep coming back for the other things that are probably more crucial than immunisation. They also appeared to have a very strong belief in do no harm, and they thought that sins of commission, doing something, were worse than sins of omission, doing nothing. Much better not to do anything than to do something and to get it wrong. So when faced with questions about immunising during pregnancy, well, it's safer not to immunise. And the final couple of points, yes, some little concerns about risk of legal action, but the other one I think is whenever people aren't sure, they will always talk about lack of evidence. So GPs mixed up in their set of other views for why you might not advise women strongly to be immunised can always say we don't have enough evidence about that yet. Second point, how you go about talking about it really matters. There's a very long history, and I'm sure midwives know this history very well, of ambivalence about healthcare provision during pregnancy and a need to make sure that it's culturally appropriate. It's not just about the words that we use, it's also about how we communicate and the way that our non-spoken language tells people things. So those things matter a great deal. We can get our pamphlets right, but if our obstetricians and our midwives and our GPs are sending tacit messages that this isn't important, the pamphlets probably aren't going to work. And the third point then is about this multiplicity of voices. I had a look yesterday I googled maternity care providers, and I came up with a list which was about twice as long as that one, that you can access if you go look at maternity websites about where you may get your maternity care from. I'd be really surprised if all of those professionals, many of whom will come into contact with women during their pregnancies, are going to be telling them the same thing about immunisation. So again, really important that key service providers are communicating the same story, but women get their professional advice from lots and lots of places. And you remember that I mentioned before that wide array of other sources as well. So here, again, when it comes to ethical issues related to the providers of immunisation during pregnancy and the programs that are offered, things can be complex there too. Final thing that I want to talk about really briefly relates to the societal perspective on this. 3 points here again. One about how we think about newborns in our society and why it might be that this is such an important issue. One about stakeholder interests, and the third about what else we could be doing. Children matter a great deal in Australian society. Immunising children seems to excite an awful lot more enthusiasm than immunising 92-year-old ladies. I have a 92-year-old mother, so this is a particular personal interest to me. But I think there are, therefore, because of the status that babies and young children have in our society, that both allows us to use that as a vehicle for potentially wanting to encourage women to be immunised during pregnancy, but it also places a significant burden on women. When you are pregnant, you are carrying around an awful lot of guilt all the time about this baby that you're going to have that everyone else seems to be really, really interested in. And once the baby's born, they're even more interested in the baby and even less interested in you. So the attitudes that we have as a society about newborns and children are something that does come into play, I think, when we're thinking about maternal immunisation. You can't talk about drugs and ethics without saying something about vested interests. I'm not going to say very much about it, except to note there is a reasonable amount of scepticism in society more broadly about why drug companies might want women to be immunised. And there are at least a minority group who do not think it's because they actually are ultimately caring about women. They may be more interested in the profit margin and in their shareholders. This, I think, is probably a more important point, and I think it's something that we don't talk about enough. Whenever we make a decision to put our healthcare resources into one area, that means we are making a decision not to spend it on something else, because we do not have an endlessly expanding pie. We have a healthcare budget that is limited. So I think it is worthwhile at least asking, what is the opportunity cost of immunising women during pregnancy? What else might the money be going to, either for women during pregnancy and their babies, or more generally in society, what other kinds of health services, or even more widely than that, what other sorts of public provision programs, what other kinds of education or social welfare might we be doing with those resources? That's a hard one, because it's not the job of the clinicians who are providing the immunisation. It's not the job of the immunisation branch to be making those decisions. It fortunately often gets to be nameless public servants who it's really easy to blame for making decisions not to fund things. So again here, we've got a set of ethical issues that are around immunisation during pregnancy that make it, I hope, at least an interesting landscape to look at. So I hope what I've done is not to make you think that I'm negative about immunisation during pregnancy, but just to raise some questions about the way in which we go about it, whose interests we might be serving, and what the values are that might underpin immunisation during pregnancy in our society. And it is a very complicated set of pictures.